Hello, my name is Dr. Asley. I'm a board-certified fellowship-trained spine surgeon, and I'm the medical director here in Sacramento's Spine Treatment Center. In this segment, I would like to talk to you about a procedure called traction decompressive treatments. The indication for this procedure is continued neck and arm pain, low back, and a leg pain. This could be done for a pain that's originating from either facet joint or a damaged disc. Now, as you can see right here in the anatomy, the spine composed of different vertebrae stacking up on top of each other, which connect to each other up front through the disc, which is a cartilage, and in the back through facet joint, which are these gliding joints. As you can see right here, the disc is a shock absorber and its integrity is very important. Once the integrity is violated, start settling down, as you can see in this model or this model. You can see that this disc at the level of L4-5 is damaged and is settled down. As the disc settles down, it gets inflamed. As you have continued inflammation in the disc, the scar tissue contracts and there's a lot of pressure built up in that area, either the disc or the facet joint. Therefore, with traction decompressive treatments, you can stretch the ligament and open up the area and decrease the intra-tissue pressures, therefore hopefully decreasing the back and the leg pain. Now, this is the table that we use for our traction decompressive treatments. As you can see right here, the patient comes in, there are two straps. One is for the chest and the other one for the hips. And the strap for the hips is connected to a computerized traction device that keeps a constant tension on a computerized program. After all, you cannot just stretch the ligaments. You have to stretch, let it go, stretch, let it go, and that way you can get the best results in terms of relaxation of the ligaments. Now, I remember I had a patient that was 75 years old, had a very bad back, bone-on-bone contact in multiple areas, and I suggested, look, if you need to be helped, you need a huge surgery. And he went out and saw 4 or 5 other doctors, and they all recommended the big surgery. And actually, they didn't want to do surgery because the surgery was too big. I saw him 2 years later in the emergency room, just bumped into him, and I asked how he was doing. He told me that actually the other surgeons told him the same thing that I told him. However, he went to another therapist and he tried traction and his pain went away and has been gone for 2 years. That was the time that I told myself I should start looking into this. And as I looked more into this procedure, I realized how effective it is. And I realized that all this time, I used to see the patients that they did have these treatments and they didn't get relief. That's why they came to see me. I never saw the patients who had these treatments and they got better. And as you can see, it's a part of our protocol in Spine Treatment Center, and our results are pretty good. After all, I don't consider this procedure an invasive procedure. It's a traction treatment, and the costs associated with this is very low. Therefore, it's a very good treatments that I offer to my patients, and I recommend them. Now, of course, when we put the patients on the table, we always tell them that about 1 out of 10 patients can experience more pain the night of or the next day, simply because it's just very difficult to break off the scar tissue. Now, I tell my patients that if that happens once or twice, we'll continue traction for the third episode. However, now, if we try 1, 2, and a third time, the pain continues to go up or pain is not getting better, then we stop the procedure. And as I said, it's a pretty safe procedure and we have very good results in terms of relieving the neck and back pain, especially if the pathology is mild. I hope you enjoyed the segment and have a nice day.